Watching TV, listening to the radio, it's likely you've heard one of these.
Start with a call to the NHS and you'll find it easier to quit and stay smoke-free.
It's an advert for the NHS Stop Smoking campaign. Now in its 10th year, the community-based service has helped an estimated 500,000 people quit. But you can expect to hear less of the programme, that's also known as Quit for Life, in some areas. It's because the government has new plans to tackle the country's growing obesity problem.
I am Hilary Saunders, Specialist Stop Smoking Advisor with Bournemouth and Poole Community Health Services. After 10 years of the Stop Smoking service in its traditional format, the service is being reshaped, where we are contracting out provision to help people quit smoking. People like dentists and pharmacies are now going to be involved in delivering the programmes, and GP surgeries are signing up for their practice nurses to help people to quit smoking as well. So we are seeing budgets cut and marketing cut as priorities change. Specialist advisors are going to receive generic training so that we will be general health advisors and be able to be transferred to different priority areas. And obviously the next big priority is going to be helping people to get fit for life as the nation grapples with the epidemic of obesity.
Exact details of the changes are to be announced in the new year, but the scheme has left many concerned about the quality of support available to those wanting to stop smoking. The new year is traditionally the busiest time for specialist stop smoking advisors, and it's unclear what services will be available once advisors have been retrained into this more generalised role.
My name is Amanda Sandford. I'm the research manager for A.S.H. About 70,000 lives will have been saved. So it's incredibly cost effective and a very important service. So we would be very keen, of course, to ensure that that continues. And I think if there is any risk that the services be cut back or changed in any way, I think A.S.H. and many other health groups would want to lobby the government to ensure that they're not devalued in any way.
Research released last week shows the number of people being diagnosed with clinical obesity has doubled since the 1980s, and by 2015, obesity will cost the UK just over £4 billion a year. It's understood the government wants to spend money now to save money later.
Clearly there are other health problems. It's good that health professionals are able to give advice on a whole range of lifestyle factors. If the stop smoking services were sort of downgraded in any way, I think that policy would be very short-sighted. We do understand that there is a growing obesity problem, and that clearly does need to be tackled, and money has to be found to deal with that. But I don't think it would help to have just simply transfer money from one problem area, if you like, to another.
It's clear primary care trusts are under pressure to deliver suitable services to the communities they serve. Until the Department of Health announces its official proposals, pressure groups such as A.S.H. will continue to lobby for a more fluid system of funding and an increase in research. Research, they say, will provide better solutions to growing problems.